Toronto's COVID-19 media briefing for Wednesday, March the 31st, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto City Councillor and Chair of the Toronto Board of Health, Councillor Joe Cressy. Mayor Tory.
Well, Brad, thank you and good afternoon. Today, the City of Toronto hit an important milestone in our ongoing vaccination efforts. More than 500,000 COVID-19 vaccines have now been administered in Toronto. 500,000 vaccines have been administered. Thanks to the Team Toronto effort, which has consisted of city-run sites, the hospitals, the healthcare partners, and the pharmacies. And we will be the first to say that there is much work left to be done. We have so far achieved a milestone unsurpassed by any municipality in Ontario at 500,000 vaccines. This is an achievement no other municipalities even come close to, but we have a lot more to do. And I'm confident that we will reach 1 million vaccines administered even quicker. But we need your help. We are continuing to urge all Toronto residents who are eligible to please get vaccinated. The City is working with all of our healthcare partners to administer vaccine doses as quickly as possible and as many as supply allows. Based on public health advice and to ensure that we continue to maximize our mega sites, we have asked the province to lower the eligibility age for people who could come to those sites and register on the provincial system in the City of Toronto to 60 years old. I had a good conversation, in fact 2 conversations with Premier Ford about this morning. He wholeheartedly supported this change, and we hope to announce details of when this will happen very soon. We really just want to get on with administering more vaccinations faster, and our participation in the provincial system requires us to make this request, to adapt the system to take account of the different eligibility. This change will ensure that we continue to fill up all available appointments and work to get as many eligible people vaccinated as our supply allows throughout the holiday weekend and beyond. We are doing everything we can as a city government to reach out to residents. Tonight, I'll be taking part in a telephone town hall, for example, with Dr. Davila, Chief Pegg, and Councillor McKelvey, the local councillor in Scarborough Rouge Park. We have reached out already to 20,000 people, inviting them to come on the telephone town hall tonight and talk directly with us and us to talk directly with them about the vaccines and to answer their questions and to encourage them to get vaccinated. We will do everything we can to make sure that people get vaccinated. I strongly urge people who are eligible to get their shot as soon as possible. Please do not wait for the sake of your own health, for the sake of getting it done now. Please do not wait. Go online now at toronto.ca/COVID-19 or call 1-888-999-6488. Our work to reach communities that are at higher risk for COVID-19, our work to fight vaccine hesitancy and other barriers to people getting their vaccine is continuing. Today, I am pleased to announce that we're making $370,000 in funding available to a number of Toronto community agencies to increase awareness around vaccines and to encourage people to get vaccinated. This funding is part of Toronto's COVID-19 Immunization Task Force outreach effort, and the TO supports Targeted Equity Action Plan. The funding will support, in particular, people in the South Asian and the Black communities. The Council for Agencies Serving South Asians, CASA, will receive a grant of $175,000 to convene a group of 10 organizations to create the South Asian Collaborative on Vaccine Engagement, which will work on outreach to Toronto's South Asian communities and work directly with faith groups and South Asian media and local influencers and community leaders to encourage people to get vaccinated. As well, the City is launching a multilingual advertising campaign next week with a micro-campaign specifically targeted to the South Asian community. The ad campaign was developed in part through a consultation with South Asian community leaders and will promote vaccination uptake through television, radio, print, and digital channels. As you know, the Black Scientist Task Force on Vaccine Equity has been working for a few months now to address the Black community's concerns and issues related to COVID-19, the pandemic, testing, and vaccines. The task force has been doing some great work in collaboration with the Taibu Community Health Centre, and I'm pleased to let you know that we are providing an additional $70,000 to extend its work over the next several months, so as to provide timely, accurate, and culturally responsive public health information on COVID-19 vaccines. The task force has already hosted 9 town halls, and the task force estimates, based on the surveys before and after those meetings, that they're gaining ground reducing vaccine hesitancy through these meetings among those in attendance. Community agencies are playing an incredibly important role in our pandemic response, and this funding will help them to continue this important work. This new work builds upon the previously announced City of Toronto Community Mobilization Vaccine Plan, which is providing $5.5 million to 140 community agencies and 240 neighbourhood vaccine ambassadors to support access to vaccines in every corner of Toronto. And we are also working with persons with disabilities organizations in our communities. The city is providing $125,000 to the Centre for Independent Living and the Miles Nadal Jewish Community Center to empower local disability organizations to respond to their specific community's needs and concerns related to the uptake of the vaccines. We will have more to say in the coming weeks about supporting targeted outreach on vaccine uptake to disabled community members through community-specific webinars and community ambassadors from within the disability community. So these are just 3 of the areas that the city staff are focused on when it comes to vaccine outreach. We know that we need grassroots efforts in many communities across the city to ensure everyone who is eligible gets all the information they need from people they trust in languages they know to make the right choice and to get vaccinated. As mayor, I want every Toronto resident, without exception, who wants the shot to get the shot as soon as supply allows. And we have a wonderful network of mass vaccination clinics and other clinics that are put in place by our healthcare partners to make that happen. That is not the issue. I plan to get the COVID-19 vaccine because I know it is safe and I know it will protect me and all the people that I care about. The sooner we are all vaccinated, the sooner this pandemic will be over. It is our best defense against COVID-19 and the variants which we know are taking their toll across the province right now. Now this weekend, many families, my own included, will be celebrating Easter, and Easter has been preceded this year by Passover, which is still ongoing, and will be followed by Ramadan. I know many people will be trying to celebrate these holidays, but they must celebrate it. We fervently hope they will celebrate these holidays in a safe way. That is so important right now. We all wish we could be gathering with family and friends in person, but again, this year, people have to be safe and celebrate just among members of their own household. We have seen time and time again an increase in COVID-19 cases after major holidays, but we are now living with the threat of variants, which is something that could have an even more profound effect in a holiday time. We have a virus that spreads much faster and much more easily and can make you much sicker, people of all ages. So please, celebrate Passover, Easter, Ramadan safely with your own households, and celebrate virtually with others. We need everyone to take this collective action to keep people safe. Easter is a season of hope, and we have hope in the vaccines. We really are almost there. We really are almost there between our own really getting behind the public health advice to keep distance and to wear masks and the things you're so familiar with, and the vaccines. We're almost there. Better days are in sight. We can get our lives back if we don't screw this up. And as important as these holidays are to so many people, I don't think anyone who thought about it carefully would trade one more family gathering or large gathering in celebration of these holidays right now for an entire summer of continued restrictions and the opportunity not to have our lives back. I just don't think anybody would make the trade if they thought about it. So I'm asking you to think about it really carefully and to behave accordingly if you possibly can. I wish all Toronto residents who are celebrating a happy Easter, but I also at the same time really sincerely and very strongly encourage everyone who's eligible to get vaccinated this weekend and to please follow public health guidance so that we can put this behind us. And if you're not yet eligible, please spend a bit of time perhaps getting a relative or a friend who is eligible to get vaccinated now. There's no time like the present. It's now time for Chief Pegg's report for today.
Thank you, Mayor Tory. Yesterday, across the network of 5 city-operated COVID-19 immunization clinics alone, more than 5,000 people received their first dose of vaccine. This means that yesterday alone, 5,000 more people made the effort to protect both themselves and those around them from COVID-19. All of us are eager to have the current restrictions lifted, allowing us to be with our family and friends, to get a haircut, to dine out, to gather with our friends, to travel, and to do all of the other things that we all miss so badly. Continuing to follow the public health advice and restrictions and getting vaccinated against COVID-19 at the earliest opportunity is what will make all of that possible. The sooner we can all get vaccinated, the sooner the restrictions can be lifted, and the sooner we can return to the activities we miss so much. I'm very pleased that more than 19,000 people have already booked their appointment for COVID-19 vaccination this week in city-operated clinics. This means that there are still vaccination appointments available for approximately 12,000 people between today and Sunday in our clinics. As a reminder, we are operating 5 COVID-19 mass immunization clinics at present. These clinics are located inside the Metro Toronto Convention Centre, the Toronto Congress Centre, Scarborough Town Centre, Mitchell Field Arena, and the Malvern Community Recreation Centre. All 5 of these clinics are open 7 days per week, with appointments available between 11 a.m. and 8 p.m. daily. All 5 of our clinics will be operating every day over the upcoming Easter weekend. This would be a great opportunity to help everyone in your circle of family and friends who were born in 1951 or earlier to book their vaccination appointment in the clinic of their choice so that they too can receive their first life-saving dose of COVID-19 vaccine. Operations in all 5 city-operated clinics are running smoothly every day. We continue to receive numerous notes of thanks from people who have received their vaccine in a city-operated clinic. I'm so pleased to hear from so many people who took the time to let our team know that they found the process to be simple, stress-free, easy to navigate, fast, and enjoyable. Many have commented on how helpful our team of professionals on site have been throughout the process, and I'm proud of our entire team. Wait times for those who arrive shortly before their scheduled appointment are very short, with most people not having to wait at all. In fact, the majority of people are checked in, vaccinated, and checked out of the clinic in about 30 minutes. I'm also very pleased that in addition to the network of city-operated immunization clinics, there are numerous other clinic locations available across the city, operated by our healthcare partners and pharmacies. On Monday, April 5th, we will open the 6th city-operated COVID-19 mass immunization clinic inside the hangar in Downsview Park. Community interest in this clinic is very high, and I'm very pleased to report that this clinic is already fully booked for Monday, April 5. There are appointments available at the hangar clinic location beginning on Tuesday next week. Anyone who was born in 1951 or earlier can book their appointment to receive their COVID-19 vaccine by accessing the online booking system, which is available through toronto.ca/COVID-19. Or, if you were born in 1951 or earlier and would prefer to book by phone, please call 1-888-999-6488. Please do not contact 311 nor Toronto Public Health for assistance in booking your COVID-19 vaccination appointment, as our staff are not able to access the COVAX system on your behalf. If you have family or friends who were born in 1951 or earlier and who may need assistance or encouragement to book their vaccination appointment, please assist them in booking their appointment. Please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. Thank you. I will now invite Dr. Davila to provide our update.
Thank you, Chief, and good afternoon. Today, I'm reporting 883 new cases of COVID-19 in Toronto. Including yesterday, the new case count totals 1,664. 29 new admissions bring the number of people in hospital to 330. On Monday, that figure was 302. At present, 53 people are in the ICU. I'm sad to report that 7 more people have lost their lives to COVID-19. The current number of cases screened positive for variants of concern is 8,570, an increase of more than 800 since Monday. An estimated 80% of Toronto's 160,000 healthcare workers have received at least their first dose of vaccine. And close to 100% of residents of long-term care and retirement homes are fully vaccinated. On our COVID-19 dashboard, we are now providing information on vaccine delivery by age group. Vaccine information on the dashboard will be updated on Mondays and Thursdays and is based on the most current 2021 population data. There's been a lot of information put forward today by those of us who've presented thus far, so I will be brief. If the current situation is described as a race, the variants are ahead by a mile. The religious holidays to be celebrated over the next couple of weeks create tempting opportunities to come together. But this is a dangerous time when you look at the rapid growth in case counts. If you gather as usual, you are taking a great risk. It is just an invitation to COVID-19 variants to spread. We know the variants are far more transmissible and cause much more serious illness. While the ability to infect is higher and the potential danger of illness is greater, how you get COVID-19 hasn't changed much at all. Being too close for too long in the wrong conditions, especially with someone who doesn't know that they're contagious. There's a period when a person is contagious but doesn't know it, if indeed they ever get symptoms. The head of the Centers for Disease Control and Prevention in the United States said this week that she's scared. If the head of the CDC says something like that, she means it. And she's not alone. The healthcare community here at home is making their fears known too. I don't want anyone to panic or to feel hopeless. I do want you to act. You are and always have been your very best protection against COVID-19, and you are the best protection for everyone you care about. At this point, the vaccines are nowhere near close to providing widespread protection. If you've got yours, that's wonderful, but you are comparatively few in number at this point. We often say, celebrate safely. In this environment, that means staying home, staying close only to those with whom you live, connecting digitally with those you don't, and if outside your home, keeping at least 6 feet between you and those you don't live with, and finally, wearing your mask as much as you can. Please do not gather with anyone you don't live with. The best treatment is always prevention. COVID-19 prevention is critical this year and never more than now. With that, I'll now hand it over to Councillor Cressy.
Thank you, Mayor Tory, Chief Pegg, and Dr. Davila. I'd like to provide a brief update on our efforts and share some new details related to our immunization campaign. Our campaign is focused on engaging people in every corner of our city, where you live and where you work, where you pray and where you hang out, on your phone, online, and in your local newspaper. At a high level, manufacturing a safe and effective vaccine is the first step. Opening clinics, accessible clinics located throughout the city, well, that's only the second step. Connecting with every resident so that they can access the vaccine when it's their turn. That is now the task at hand. And so as part of our ongoing efforts to support vaccine uptake in targeted population, as Mayor Tory has mentioned, today we're announcing 3 new measures. First, funding support for the South Asian community through a partnership with the Council of Agencies Serving South Asians. A partnership that will engage 10 agencies serving the South Asian communities to undertake vaccine outreach and work with local community and faith leaders. And as part of this South Asian outreach, the city is also launching targeted advertising in print, radio, digital, and television in Urdu, in Hindi, in Punjabi, in Tamil, and Farsi. Second, we are extending the work of Toronto's Black Scientist Task Force, which was originally scheduled to end in April, now until July. Since it started, this task force has worked relentlessly to promote vaccines and confront vaccine hesitancy, and the results have been excellent. Across more than 9 town halls, we've seen a reported reduction in vaccine hesitancy of 16% by those who participated. And third, we're launching targeted supports for people living with disabilities. Through a partnership with the Centre for Independent Living, we are supporting outreach efforts for people living with disabilities to access vaccines. These 3 initiatives, well, they're just one piece of a broader campaign to support targeted populations. Last week, Mayor Tory told you about our ongoing work in the seniors community, and in the coming weeks, we'll have more to share on our efforts to support other targeted populations, such as the Latin and LGBTQ2S communities. Now, this is all part of a broader vaccine mobilization campaign. It is the largest community mobilization effort ever undertaken in our city's history. These efforts include 140 community agencies on the ground who will be going door to door, 280 vaccine ambassadors, trusted local leaders in their neighborhood. As you've heard, Toronto Public Library calling their 35,000 members over the age of 70, Wheel-Trans contacting 26,000 customers, TCHC going door to door and supporting mobile clinic in all 83 seniors buildings, and of course, transportation options to support people and seniors to access clinics. All this work is just the beginning. Because right now we need to get shots in arms to the most vulnerable as quickly as possible. That is how we save lives. But to win this immunization campaign, we must ensure that every resident who wants a vaccine can access one. Every resident, every worker, in every language and in every corner of our city. This is, for me, the most important campaign of my lifetime, and I'm sure for all of us. And at the city, we will stop at nothing to ensure that it is a success. With that, I'll turn it over to Brad Ross.
Thank you very much, Councillor. Just a reminder to reporters to unmute yourself before asking your question. We'll go first to Matt Bingley at Global News. Matt?
Hi, good afternoon. Dr. Davila, based on Toronto's pandemic situation right now, what specific restrictions would you like the province to enact tomorrow which could help the city regain control over infection spread?
You know, Matt, I appreciate the question, and, you know, I think in order to try to respect the process that occurs, you know, there are discussions that happen all the time here at the city and with our counterparts at the province. I would say this, there's no question, we're in a very serious situation here. We're in a situation here in Toronto, but that serious situation extends beyond the boundaries of Toronto and goes across the province. I don't think that this is a simple situation. It's one that no one single jurisdiction can manage on its own. And I think the seriousness of the circumstances requires actions that are commensurate with that. And I think we're talking about actions that can be made to work, that reduce harm, that reduce risk, and keep people as safe as possible.
So just to pick up on that, in the past you have said before an announcement, what you would like to see personally. Are you saying that you would like to see a province-wide stay-at-home order again, or something in that manner?
I'm saying, Matt, that we need to continue discussions with the province, that I would like to respect the process that we have with them, that we need actions that are commensurate with the risk that we see, and that really think about what can be done to actually keep as many people as safe as possible, given what we're seeing right now. We are in a delicate situation, and it requires delicate work and I think a very serious approach to the risks that exist.
Okay, thank you. We'll go next to Shalima Maharaj from Global News. Shalima?
Hi there. Thanks so much for taking my question. My question revolves around COVID-19 transmission within schools. We've heard from parents who don't feel that they've been adequately informed when there's been a positive COVID-19 case in their child's school environment. How does, for their knowledge, Toronto Public Health determine when to reveal that type of information? And how do you determine when students or a cohort need to be isolated?
So that's a couple of questions all in one, and I'll see whether I can answer that as concisely as possible. At this point in time, as we see that there's a significant amount of COVID-19 in our community, we are seeing a reflection of that in our schools and are seeing COVID-19 cases in schools. We have worked very hard with our school board partners to put in a number of measures to protect both students and staff that are working in those environments. And in the event of a COVID-19 case, there is a significant investigation that's required to understand what the circumstances are there. Given the number of cases that we're seeing, given the activity in the community, there are varying processes that need to be put in place. If we can quickly determine cases, then it's easier and determine the origin of cases, and when investigations can be done relatively quickly, we can inform the community very quickly. There are other times where the investigations are more complex. What we often do in those situations, particularly when determinations can't be made in an expeditious fashion, we will work with the school board to mitigate risk as quickly as possible. That may require the dismissal of a cohort or a whole school. It may involve testing. Each situation warrants its own assessment, and the actions are taken in concert with school board partners, depending on what we see on the ground. So there isn't a single, one-size-fits-all approach. It's actually based on what circumstances we see in each individual school.
Shalima?
One more question, of course. I do want to know as well. We know that obviously staff and students, they are required to complete a screening tool each day before going into class. For those who are noticing that perhaps one of those or more may not be followed, so for instance, if anyone in the household is self-isolating at home because they were a close contact of someone who had COVID-19, all kids in the household need to stay home for the full 14-day period. If they notice that some of those rules may not be followed, what can they do? What are their options?
First and foremost, I would first encourage people to, follow the rules as much as possible. These are there to protect all of us. We have seen that none of us really wants to make other people sick. We recognize that these are challenging circumstances that we're living through. But I would first and foremost encourage people to do follow the rules because they're there to protect all of us, to make those environments as safe as possible for students and for staff. If there are particular concerns, I think that's something that's best followed up at the local level, first with the school to understand what the circumstances are. Sometimes, things are circulated within communities and things aren't always exactly as they appear. So I do feel that the best thing to do is to have conversation locally, to try to address those matters locally, and if need be, I'm sure our school board partners and the school partners themselves will connect with us, the public health team that's supporting them, to try to problem solve and come up with the best solution for the circumstances in that local environment.
Thank you. We'll go next to Sneha from CBC News.
My question is for Dr. Davila. There are a lot of calls for the province to consider cancelling the planned school break in April and go to remote learning. Toronto has a number of schools shut down due to COVID. Should we be looking at remote learning until the threat has lessened and more people are vaccinated?
So that's an interesting question, and one that doesn't exactly have a very simple answer. I would say this. You know, the school break is still, you know, a number of days away. And as we've seen here throughout the course of the pandemic, so much changes, not just over the course of a day, but sometimes over the course of hours, and sometimes even shorter than that. So, you know, there are important decisions that need to be made with respect to the education system. Much of this resides outside of the purview of local public health. We, of course, are eager to contribute, you know, and help decision makers by providing our experience on the ground so they understand what is happening here, what we're observing. We see that as an important part of local public health, and certainly the local schools themselves have a role to play in that. And I think that ultimately the decision does rest with our provincial counterparts. But of course, I think people can rest assured that we are all committed to trying to make schools as safe environments as they can be for students and for teachers. And we are looking all the time at the overall health picture of the children. We really are considering all the different issues that contribute to the health of children. Part of that is the COVID-19 risk, and part of that are all the other health issues related to schooling.
Thank you. My second question is, we are aware that a coalition of lawyers plans on pursuing legal action against the city related to the clearing of encampments in parks by April 6. Advocates are concerned that this notice will lead to mass displacement of vulnerable people during pandemic. Are you still going to clear the encampments in early April, and why now?
I will just say that what we have done in this case is to put together a very carefully and thoughtfully put together plan to move people who are in encampments in public parks to better housing, to permanent housing. These encampments are not safe, they are not healthy, and they do not belong in public parks. They're not to be in public parks. But we're not just clearing them out, we are preceding that by extensive work that is going on right now to talk to each and every one of those individuals and find them better housing. Housing that is indoors and that is going to be much more suited to humane treatment of those people and to support to be given to them in response to their experience of homelessness. We're working extensively with city councillors, with city officials and others, and directly with the people involved, the clients involved, to make this something that is a successful experience. And I just would hope that more people, even more people in the community, could get behind this effort, because I think it's the right thing to do. It accompanies efforts we've made over a period of months to rehouse successfully literally hundreds and hundreds of people from encampments into better housing, more humane housing, and to not have them in unsafe, unhealthy encampments that are not consistent with the law and that cannot be left indefinitely in public parks.
Thank you, Mayor Tory. We'll go next to Mark Douglas from 680 News. Mark?
Thanks, Brad. To Mayor Tory and to Dr. Davila, to be clear on something that you said right off the bat, vaccination for Torontonians as young as 60, how soon could that begin? Do we really have that much vaccine on hand right now?
What we have right now, and I'll start with this just in the context of logistics, what we have right now are clinics that have appointments that are not yet filled, and those appointments are accompanied by a vaccine supply. We wouldn't have made the appointments available if we hadn't been sure of the supply. And so as you see a tailing off that has happened 2 or 3 times now with successive age groups of people booking for a variety of reasons, I'm sure, then I think it makes sense for us, given that we have the clinics, we have the appointments, we have the professionals, we have the vaccine, it makes sense for us to move to different groups, which is why we ask the province to do that. The reason we have to ask them is because we're on their registration and scheduling system, and it's worked very well. I want to compliment them on that, but we have to ask them to make a change, a software change, to accommodate these different age groups, and so we wouldn't be offering the appointments to people if we didn't have the vaccine.
Follow-up, Mark?
In there, but that's okay. A follow-up question then. So, sorry, I'm not sure I got a clear answer on that. So, as soon as the province says, okay, you want to be able to just go ahead and start vaccinating 60-year-olds, this could begin tomorrow.
To make it clear that we've told them, my discussions with the Premier directly and with the officials at the province are to say if they could do it this afternoon, that we would be ready to take appointments right away. As soon as they change the software to allow people, the way the system presently works is that it is programmed such that only health cards belonging to people at this point in time 70 years of age and older are allowed to or are able to use the system to book an appointment. And if they could change that in 30 minutes from now, we could start booking appointments for people at whatever the new age is. And that's what we'll do as soon as they let us do it. And we understand it does take some time. We hope as short a time as possible to make that software change. But we're ready to go with appointments. We've said that quite openly, that there are appointments that are available this weekend for people who become eligible to sign up, or those who are already eligible who haven't yet gone to do so. And we're urging all of them to do it now. And now is the time to do it. There's no time like the present.
Okay, thank you. We'll go next to Jennifer Pagliero from the Toronto Star. Jen, go ahead.
Hey there. First question's for Dr. Davila. Doctor, do you think it was a mistake to open patios given the current numbers that you're seeing? And just if I could tie another quick related question in there is, what would you say to residents now who may be rightly confused when they hear you say, stay home to protect yourselves, but also the law allows them to go to a patio and no one's going to actually check if they're there with friends from other households?
Well, I think what we're seeing and what we understand from the course of the pandemic and the science and evidence that we've seen over the past several months is that activities outside are indeed lower risk for transmission. So the actions that have been taken to date are cognizant of the fact that we are still very much in the midst of a pandemic, that there is still ongoing transmission of COVID-19, that yes, there are vaccines, but just not yet covering enough of the population that they're able to provide that protection. But we do know that outdoor activities are definitely lower risk, and that, it has been a long and difficult several months, and, after a winter, that we are all often looking for opportunities to be able to be outside and to enjoy warmer weather as spring weather arrives. So this is one of those many decisions, like many that have been made throughout the pandemic, that of course are based on evidence and the best available science, based on our experiences, the experiences of other jurisdictions, and as well that just take into consideration the current state of mind and where we are as a community and what our needs are, looking at health overall, COVID-19 being key amongst those concerns, but recognizing that there are other aspects to health. So at this point in time, we know we're in a very serious state. We are seeing pressures on our healthcare system, increased hospitalizations, increased case counts, increased ICU admissions. So at this point in time, we are continuing to ask for people to practice those measures for self-protection, which we know work. COVID-19 transmits from one person to the next in close contact. Distance, and distance continue to be the most important things. And of course, now that we have vaccine, getting vaccine as soon as you can when it becomes your turn remains another mainstay of protection against COVID-19.
Second question on a different topic for Chief Pegg. I wanted to ask, I know that there's been some reports of at least some of the shipments of AstraZeneca that some provinces have received expiring relatively soon, I believe on April the 2nd. I wanted to ask, is there any concern of any of the vaccines allocated to Toronto expiring before you are able to use them? And if so, what's the plan to try to get those shots in arms?
So first and foremost, I am not aware of any concerns relating to the upcoming or potential expiry of vaccine. That's something that it's certainly not a concern that I'm aware of, and I don't believe that there is any risk associated there. Also important to note that AstraZeneca is not in use at present within our city-operated clinics. It is being provided by the province of Ontario directly to pharmacies and some primary care providers and family doctors and the like. So again, a provincial responsibility to procure and deliver. The vaccines that are in use in our city-operated clinics at present is Pfizer, and the majority of our healthcare partners and mobile teams are operating with Moderna, so not aware of any concerns on any front.
Thank you, Chief. We'll go next to Nick Boveda from CBC News. Nick?
Hi, thanks. Question for Dr. Davila and Mayor Tory. And I'm wondering if you can provide some advice, and this could be medical advice or maybe based on your own personal experience, for people who are maybe right now fielding some texts or calls from family members who are maybe planning Easter gatherings or have some other expectations about getting together this weekend. Do you have any advice for people on how they should manage those kinds of conversations when there's maybe some tricky family dynamics at play?
Well, perhaps I'll start and I'll let the mayor speak thereafter. As I mentioned in my remarks, now is not the time to gather. We are in a situation at a point in time in this pandemic where we're seeing increased case counts and all that goes with it as a result of the variants of concern. More hospitalizations, more ICU admissions, and affecting a younger segment of our population. So, you know, my plea to the people of Toronto is to celebrate the holidays, but to do so only with the people with whom they share a roof. For those with whom you don't share a roof, for all other members of the family, I would suggest that the best thing to do is to connect virtually or to connect digitally. We have done this before, and I think the mayor just mentioned in his remarks earlier this afternoon that surely it's worth taking a pass this one time so that we might be able to enjoy, you know, a more fulsome summer with less restrictions and something that's more akin to life as we knew it before COVID-19. We remain our best protection against COVID-19 for ourselves and for all those around us, but only if we choose to exercise that power that we all have to be vigilant and to continue keeping distance as much as possible. Mr. Mayor?
Well, I won't offer any medical advice. That would be dangerous, but I will say this. I have seen with my own eyes and experienced virtually that Norwoo's, for example, celebrated by 300,000 people, a very important holiday for those people, was celebrated virtually because I attended a number of those celebrations and families gathered within their own households and hooked up with other families, and it wasn't quite the same, but they enjoyed the experience and they celebrated the holiday. I've seen with Passover last weekend, Seder after Seder, of people who were in their own homes with their own family but hooked up to other families and hooked up to their synagogue celebrating Passover together. And I know that we can do the same thing for Easter. It is maybe not as fulfilling and as warm and as fun as to have all your relatives there, but if you think about the trade-off, who would trade just missing one more of these important family occasions that we've missed over the course of the last year for another several months or longer of misery and for more people dying in our community and for more economic damage being done? It's a bad trade. And so I would just say to people, let's explain the health risk as best one can in terms of how risky this is, but also explain to them that it's just not a good trade-off. You know, missing one more family occasion, as sad as that may be, is not something that you would say is equal to the damage that could be done by having this pandemic go on for months more.
And for me, I'll pass it on to some of my colleagues. Thanks.
Okay, Nick, thank you very much. We'll go next to David Ryder from the Toronto Star. Dave?
Hi, everybody. Thanks for taking my question. The question is for really whoever feels best suited to answer it. And that is, although Mayor Tory talked the other day about efforts to try and get homebound seniors vaccinated, we're hearing that many of them are still having trouble getting appointments, including a woman who's desperately trying to get her 97-year-old father vaccinated, so far without no luck, even though caregivers are coming and going. Is there something we're missing? Is there something the city is doing to try and get those people vaccinated when many people who are younger than them, who are just mobile, are able to go down to a clinic and get protected?
So, Dave, thanks for the question, and I'm sorry to hear that this individual is having challenges getting her 97-year-old father vaccinated. For those seniors who are homebound, again, this is an issue that is regularly dealt with by our healthcare partners. We know that there are roughly about 3,500 people in the City of Toronto who are in a condition that really prevents them from even going out to medical appointments on a regular basis. Each of these people is generally served by a home care agency, whether it's publicly funded or privately funded, and or has a primary care provider. You know, the way the program works, as it's been described to me, I should say, by our healthcare partners, is that each of these individuals should have contact with their home care provider, whether it's the physician, a primary care physician, or a primary care provider who provides in-home care, or a home care agency. A simple call to that agency or provider is the best way to start off that conversation. There is a program in place. It's very similar to the homebound influenza vaccine program that's run every single year. So that would be my first suggestion in terms of following up to make sure that that individual gets their COVID-19 vaccine.
Thank you. And then follow-up, I think, is for Chief Pegg, which is, you said earlier about things sort of happening smoothly at the city-run clinics. We got reports from yesterday of, particularly at the Thorncliffe location, of there being very long lineups and elderly people having to stand in line for a long time. What was described to us as sort of some disorganization. Have you heard that? Is there any problems that need to be dealt with on that?
David, I have not heard that, to be very candid. The Thorncliffe location is a partner clinic of ours that is operated by these Toronto Health Partners. And as such, I don't have direct lines of visibility into the operations or performance metrics for that clinic on a day-to-day basis. I was not made aware of any issues there, so certainly something we can follow up with our partners on, and I will certainly take that offline to do.
Thank you. We'll go next to Natalie Johnson from CTV News. Natalie?
Hi, everyone. A question for Dr. Davila. Pfizer says that its COVID vaccine is 100% effective in protecting kids aged 12 to 15. I'm wondering if you can discuss what kind of impact there would be if that age group was approved to get the vaccine here.
So, Natalie, I haven't had the chance to see, I did hear about that. I haven't actually had the opportunity to review any of the data, and certainly anything that has to do with the licensure of vaccine is something that happens at the federal level. So I'll certainly look forward to hearing what our federal partners have to say about Pfizer's data, which I'm sure they're sharing, I would expect, with federal regulators who are responsible for the licensure of vaccine. I would say this, of course we're interested in seeing as many people as possible vaccinated, but we want that vaccine to be safe for use in all the populations. So I'll look forward to seeing the data and look forward, of course, to hearing what our federal partners have to say about it.
So if it is approved for kids that age here, do you think that would have an impact on achieving herd immunity and reducing the transmission, say, in schools or youth sports or any sort of, teenage social gatherings?
Yeah, well, certainly if the vaccine demonstrates the level of effectiveness that we've seen in other populations, if it's that effective in young people, then certainly I would expect that it will offer that protection to those individuals and support restoring regular activities amongst youth and throughout our community if it becomes used as part of the vaccine campaign here and throughout the province.
Thank you. Final question is to Tina Yazdani from City News. Tina?
Hi, thank you for taking my question. I just wanted further explanation on why Toronto has to ask permission to lower the age group. We know other regions like Halton and York are making those decisions on their own. And if it is simply because Toronto is using the province's booking portal, is that the best idea if it's going to delay moving on to the next age group?
Well, I want to start, and I'll let Chief Pegg pick up on this. I want to start by saying that I believe and I support the decision that was recommended to us to employ the province's system. When you look at the scale of what we had to deal with here in terms of 3 million people and all the complications of multiple clinics today, we have 30 clinics in place across the city. We either had to try to build our own to be able to accommodate that, or use theirs. And while some people have chosen not to use theirs, I think our experience with their system has been very successful. People have not, of all the complaints we receive about different things, and there aren't that many of those either, very few have to do with the registration process. If there is any downside to it, it is simply that they have to make a software change to their system in order to change the eligibility of people to receive the vaccine. And so that was something that we had to contend with when the decision was made. But from my perspective, and I end up accountable for most of these things at the end of the day because I'm the elected representative here, and that is that I think we made the right decision. And I think the system has performed well for us, but it does mean we have to ask. And I will say this, in fairness to the province, when we have asked, they have said yes. And we hope they can say yes and implement it as quickly as possible. And so far, I indicated we'd love to have it done today on 12 hours or 12 minutes notice, but so far they've moved with considerable speed to get these things done, and I hope that will be true in this case as well, and that it might be done ASAP, like within a matter of hours, not days.
Go ahead, Chief.
Not a lot that I can add to Mayor Tory's comments, other than really to echo what the Mayor just said. I fully support the decision that we made collectively as a team early on to be clients, if you will, of the provincial booking system. The system has in fact worked extremely well, and I fully echo what Mayor Tory indicated, that trying to operate and manage a booking and scheduling system for an enterprise as large as the vaccine effort in the City of Toronto requires that level of provincial coordination. So the system provides both Ontario, the Ontario government, with direct visibility into our clinic operations, and vice versa. With us being a client, it gives us the ability to be nimble and to be responsive and to make operational changes as we go. I think it's a right decision. It's performed very well. And like Mayor Tory said, from my level at a staff perspective with our colleagues in the province of Ontario, they've been extremely responsive to all of our needs and to all of our requests, as we're seeing now with the most recent one and the hopefully soon transition to age 60.
Thank you for that. I also wanted to ask, we're getting some reaction to 12,000 appointments being open between now and Sunday. Does that seem like a lot to you? Are you concerned that these appointments aren't filling up faster? Does it tell you anything about maybe mass vaccination clinics aren't the best way to reach the elderly population, or do you think that 12,000 makes sense between now and Sunday?
I think that 12,000 does make sense between now and Sunday when you consider that we are offering thousands and thousands of appointments each and every day across the city. 12,000 in terms of what we're talking about in the order of magnitude of the vaccination effort in a city the size of Toronto. That's not certainly not a large number in accordance with what we're used to dealing with. We watch and monitor bookings, and we monitor appointment uptake very, very carefully. It's happening hourly and on a day-to-day basis, and is literally something that is reviewed with our Immunization Task Force Command Team every single day. And at the point where the number of bookings starts to tail off, that's immediately flagged. And the very moment that there becomes any visibility of a downward trend, meaning that there are fewer and fewer appointments being booked, that is what triggers our internal discussions that ultimately lead to the discussions Mayor Tory spoke about, whereby we're able to connect directly with the province of Ontario and very quickly request that additional eligibility is opened up. We all have the same goal, and that is to maximize the throughput, maximize the output of all of our clinics in order to administer as very much vaccine in the shortest amount of time possible to every single person that wants one. And there are really, the limiting factors are literally vaccine availability. So that's a federal issue that we're continuing to manage, but we will continue to monitor. There's good changes being made, and I'm confident that we're on the right path.
Tina, here's the key. We want to get every appointment filled up, so that I'm confident that with your help and with the help of City News that we can get people to either go to toronto.ca/COVID-19 and register on the button that's there, or call 1-888-999-6488. And whether we have 27, 270, 2,700 or 27,000 appointments available. We want them all to get filled up, or as many as possible, so that we can get those needles in the arms, and I know you can help us with that.
Indeed. Thank you very much, everybody, for joining us. That concludes today's briefing. Please stay well.